Hello, I'm Dr. Shom Goel. I'm a medical oncologist and lab researcher at the Peter MacCallum Cancer Centre in Melbourne. This morning, I had the pleasure of presenting at the plenary session at the COSA 2023 annual meeting. The session was about the topic of metastatic breast cancer. And in my presentation, I discussed some of the approaches that the breast cancer community has taken in recent years that have driven progress in respect to reducing deaths from breast cancer. And I particularly focused on the approaches with respect to the development of new drugs. The first point to make, I think, is that we have made real progress in Australia in our fight against breast cancer. Even though the number of new cases of breast cancer continues to increase each year, the number of deaths is decreasing. And I believe that the development of new drugs for breast cancer is a large contributor to that progress. In my talk, I briefly outlined what I considered to be 4 different approaches, scientific approaches, that the drug development community has taken in recent years that have fueled that progress. The first one was what I called targeting the lineage pathway. And what I mean by that is our recognition of the fact that many of the same processes that cause normal breast cells to proliferate also cause some breast cancer cells to proliferate. And that by understanding how normal breast cells work, we can improve the way we treat breast cancer. And examples of drugs in this class are hormonal therapies and the cyclin-dependent kinase 4 and 6 inhibitors. The second approach I talked about was targeting the driver. And here I'm referencing the concept of looking for genetic changes in breast cancers that we can then go after. And the poster child example for this is targeting HER2 in breast cancer. And HER2 therapies have revolutionized outcomes for many of our patients. The third approach is what I called targeting precisely. And here I'm really referencing the development and sudden explosion in the field of antibody drug conjugates, where for the first time we're seeing the ability to selectively deliver drugs to a tumor whilst sparing other tissues in our patients. And finally, I talked about a scientific concept called synthetic lethality. And what I mean by that is that in certain breast cancers, we recognize that the cancer's strength can also be its weakness. And a classic example of this is cancers in patients with BRCA1 and 2 mutations, which are uniquely vulnerable to PARP inhibitors. So I concluded by saying that in addition to these 4 approaches, I think a 5th angle that we must pursue in the future is improving the effectiveness of immunotherapy for breast cancer. And I outlined some of the ways I think that we might be able to do that. And I also made a call at the end of my presentation for continued funding in Australia for both laboratory and clinical research, recognizing that all of the progress we've made in the last 30 years couldn't have been possible without those research efforts.